Are you ready for a world where AI is your coworker in the operating room? Microsoft just dropped a bombshell, Dragon Copilot, a brand new AI assistant specifically designed for healthcare. But here's the burning question. Is this a game changer that saves doctors from burnout? Or is it the first step towards replacing them altogether? The truth is, the lines are blurring faster than ever before, and the stakes are incredibly high. The secret data that Microsoft isn't telling you will shock you. Stay with me, because this could change everything about how you see the future of healthcare. All right, let's break down the news. Microsoft is rolling out Dragon Copilot, which they're calling the first unified voice AI assistant for clinical workflow. Basically, it's designed to help doctors with all the tedious tasks that take them away from actually treating patients. This thing combines the voice dictation smarts of Dragon Medical One, or DMO, with the ambient listening capabilities of DAX Copilot. Think of it as a superpowered digital assistant that's always listening and ready to help. Microsoft claims it's all about reducing clinician burnout, improving patient experiences, and boosting efficiency. Sounds amazing, right? But what's the real story behind the hype? It is built on Microsoft Cloud for healthcare, ensuring security and compliance. Now let's dive a little deeper. Dragon Copilot is built on 3 core technologies: automatic speech recognition, ASR, natural language processing, NLP, and generative AI. ASR is what allows the system to understand and transcribe spoken words with incredible accuracy. NLP then kicks in to interpret the meaning of those words, extracting key information and context. Finally, generative AI is used to create summaries, generate reports, and even draft referral letters. Microsoft is leveraging a technique called fine-tuning to adapt these models specifically for the healthcare domain. This means they're training the AI on massive datasets of medical records, clinical notes, and research papers to ensure it understands the nuances of medical language. And it is important to note that the architecture is HIPAA compliant. According to the paper Large Language Models in Healthcare, Opportunities and Risks, Nature Medicine, 2023, these technologies have the potential to revolutionize clinical documentation and improve patient outcomes, but responsible implementation is crucial. But there's a dark side we need to consider, and we'll get to that in a minute. Microsoft claims that Dragon Copilot can save clinicians 5 minutes per encounter, reduce feelings of burnout by 70%, and even make them 62% less likely to leave their organization. And get this, 93% of patients reportedly have a better overall experience. These are huge numbers. They're saying clinicians can streamline documentation with multi-language support, automate tasks like conversational orders and after-visit summaries, and even conduct medical information searches from trusted sources, all within a single interface. Think about it. No more endless hours spent typing notes, searching for information, or filling out paperwork. This could free up doctors to spend more time actually connecting with their patients. WellSpan Health is already raving about how Dragon Copilot is enhancing their EHR workflow and delivering a consistent, intelligent experience across their organization. It's a game changer, they say. But is it really? Or is there a catch? Okay, here's where things get interesting. On one side, you have the evangelists who believe that AI is the savior of healthcare, freeing up doctors to focus on what they do best, caring for patients. They argue that tools like Dragon Copilot can reduce administrative burden, improve efficiency, and ultimately lead to better patient outcomes. On the other side, you have the skeptics who worry that AI will lead to job displacement and a dehumanization of healthcare. They argue that relying too heavily on AI could erode clinical judgment, compromise patient privacy, and ultimately create a system that's more focused on efficiency than on empathy. The truth, as always, probably lies somewhere in the middle. But here's the key question. How do we ensure that AI is used to augment, not replace, human clinicians? One way to verify the impact is through A/B testing, comparing clinician performance and satisfaction with and without Dragon Copilot over a significant period. But even then, can we truly measure the human impact? The emotional cost of potential job losses? The subtle shift in the doctor-patient relationship? These are the questions we need to be asking. Let's explore these opposing viewpoints a bit more. The pro-AI camp points to the growing shortage of healthcare professionals and the rising rates of clinician burnout as evidence that technology is desperately needed. They argue that AI can help bridge the gap, allowing existing clinicians to handle a larger patient load without sacrificing quality of care. They also emphasize the potential for AI to improve accuracy and reduce errors in diagnosis and treatment. Imagine AI flagging potential drug interactions or identifying subtle patterns in patient data that a human might miss. The anti-AI camp, on the other hand, warns of the dangers of algorithmic bias and the potential for AI to perpetuate existing health disparities. They argue that AI models are only as good as the data they're trained on, and if that data reflects biases, the AI will simply amplify them. They also raise concerns about the lack of transparency in AI decision-making and the difficulty of holding AI accountable when things go wrong. Who's responsible when an AI makes a mistake that harms a patient? The programmer? The hospital? The doctor who relied on the AI's recommendation? These are complex ethical and legal questions that we need to grapple with. So, what does all of this mean for the future of healthcare? Well, it's clear that AI is here to stay. The question is not whether AI will be used in healthcare, but how it will be used. Will it be used to empower clinicians and improve patient care, or will it be used to cut costs and replace human workers? The answer depends on the choices we make today. We need to invest in training programs that equip clinicians with the skills they need to work alongside AI. We need to develop ethical guidelines and regulatory frameworks that ensure AI is used responsibly and fairly. And we need to foster a culture of transparency and accountability in AI development and deployment. Dragon Copilot is just the beginning. As AI technology continues to evolve, we can expect to see even more sophisticated applications in healthcare. Imagine AI-powered robots assisting with surgery, AI-driven diagnostic tools providing personalized treatment recommendations, and AI-enabled virtual assistants providing remote patient monitoring and support. The possibilities are endless. But we need to proceed with caution, ensuring that AI is used to enhance, not diminish, the human element of healthcare. All right, let's wrap things up. Microsoft's Dragon Copilot is undoubtedly a significant step forward in the application of AI in healthcare. It promises to streamline documentation, reduce clinician burnout, and improve patient experiences. But it also raises important questions about the future of healthcare and the role of human clinicians. The key takeaway here is that we need to approach AI with a critical eye, recognizing both its potential benefits and its potential risks. We need to be proactive in shaping the future of AI in healthcare, ensuring that it is used to create a more equitable, compassionate, and effective system for all. Now, I want to hear from you. What are your thoughts on Dragon Copilot? Do you think it's a game changer or a potential threat? Let me know in the comments below. And don't forget to like and subscribe for more in-depth analysis of the latest AI trends. Because the future is coming, whether we're ready or not, and we need to be prepared.